So for this discussion, I had key ideas number 2 and number 4 for chapter 1 and number 4 for chapter 2. Key idea number 2 says that U.S. medicine during the 19th century was heavily influenced by Scottish and French clinical medicine and German medical science. So when American medicine was first coming about in the U.S., a lot of the doctors were trained inside programs, not at universities, and they didn't have very much training. To get more training, then a lot of them went to either the University of Edinburgh, Glasgow, or Aberdeen. From going over abroad, we learned a number of things. So at the University of Edinburgh, which reflects the culture of Scotland, they were really emphasizing addressing the whole of mankind. So people were trained in numerous disciplines, which led to close observations of patients and case-based clinical trialing, whereas French clinicians really had developed an understanding of pathology and physical diagnoses, and they were using these classifying diseases by symptoms and morbid anatomy. So they were really pulling an evidence-based focus and keeping it kind of biomechanically based, whereas the Germans were emphasizing experimental research. They made connections between sciences in the laboratory and between sciences in medicine. So they were doing these at the universities, which were pushing the research forward. What they got from German scientists and medical health professionals were that controlled research was really important and that clinical scholarship was necessary for medicine to advance here in the U.S. So overall, there was some key importance that we got from both the French, the German, and Scotland. That was clinicians knew what they were supposed to, exactly what to do. They needed to take medical history, they needed to conduct a physical exam, and look into other investigations. And there was now criteria for specific diagnoses, and that research needed to be controlled and emphasized, and that medicine needed to become more scholarly. So the U.S. started adopting these policies, and med schools across the country reformed their departments. Stricter admission requirements were made, and courses were lengthened, and core classes such as anatomy and physiology were added to the schedule. Question number 4, or key idea number 4, states, medicine embraced a form of 17th century science built upon the work of Bacon, Descartes, and Newton, and based on empirical observation, material mechanisms, reductionism, and determinism, and dualism. So Bacon was a philosopher, and his big key idea was the inductive method of discovering truth. So he emphasized doing observation, analysis, hypothesis, and then verifying that hypothesis. Today, this is kind of what we use as the scientific method, which is the basis for all really any medical theory that we would use in practice. Descartes is a philosopher also who really emphasized that there's different reality in mind and body, in the body as is a machine. And Newton, who you guys all know, really emphasized that the body is merely the sum of its parts, and it is this influenced proper medical thinking and led to what we have in medical practices today. Question number 4, chapter 2, 4 barriers divide physicians from their patients and make it difficult to work with these patients to repair their illness stories. These barriers are understanding of mortality, context of illness, beliefs about disease causality, and emotions of shame, blame, and fear. So the book kind of talked about how when people come into the physician to see a physician, they usually come in vulnerable and they tell their illness story, and the doctor and the person coming in have different viewpoints on this, and these 4 divides really show the different viewpoints that they have. So the first is the relation to mortality. Doctors see patients that are ill every day. They see death, they see dying. So doctors really have came to accept that everyone dies. Whereas a lot of patients, they don't see this on a normal basis, and this is not something that is part of their reality, and they may have not concretely accepted this yet. The second is the context of illness. So doctors tend to see things more narrowly, more focused on the body and curing, whereas patients see more of the bigger picture of how this is affecting their life and what they would like to be able to do and what this is preventing them to do. Beliefs about disease causality. So this can depend on someone's culture a lot. If someone thinks they're sick due to karma or due to acts that they have performed, it may affect how they go about treatment, and especially if they disagree with what has caused it by the doctor. This can lead to some tension on how to treat and move forward with treatment. And lastly, the emotions of shame, blame, and fear. These have all been shown to make illnesses worse, documented on research, and it can cause intense suffering, and if this is not addressed, it prevents effective care not only from fixing these problems, but from fixing the actual biomechanical problems that are going on. I thought it was really interesting that the book says these are the same divides that people can separate them from themselves and not realize they're doing this.